Hello, my name is Dr. Bayan. I'm a consultant in pain medicine and anesthesia at University Hospital Leicester NHS Trust, United Kingdom. Today we're going to talk about suprascapular nerve block using ultrasound. Today I'm going to show you the suprascapular nerve block. In order to perform this block, the position of the patient I usually have patients sitting, and I always try my best to ask the patient if they can touch the opposite shoulder. Now, if you have a pain in the shoulder, the majority of your patients won't be able to do that, but it's one of the ways to increase the safety of this block, as the pneumothorax has been described. Doing this, you are moving your scapula away from the chest wall and minimizing the chances of injury to the pleura. The second thing I do is to feel for the scapular spine, and then I'll put my probe onto the scapular spine. As you could see, it's a continuous line which you see at the moment, and then I'm going to move my probe so that I can start to see the suprascapular fossa. The continuous line you see on the screen here is the suprascapular fossa, and you have two muscles. That's your trapezius, that's your supraspinatus. The next thing we're going to do is to keeping an eye on the fossa, and then trying to see the break in that line, which will point you towards the suprascapular notch. So as you see, that's the line, and there's a dip there, which is a small vessel pulsating, and that is your suprascapular notch. So in order to perform this block, if you're performing the radio frequency, you would like to be close to the nerve, and you could do an outer plane approach, or you can do an in-plane approach. I perform an outer plane approach, putting the needle close to the nerve, doing the sensory stimulation, motor stimulation, and pulse radio frequency. But if you're performing the diagnostic block, there's no need to aim the notch. You could actually inject the local anesthetic just in the fossa, as you could see here, continuous line. If you put the local anesthetic in the fossa, the cadaveric studies show if you inject the dye, you will get the spread of the local spread of the dye to the suprascapular nerve. So this is how you would perform the suprascapular nerve diagnostic block in the suprascapular fossa. And to perform the radio frequency, you're looking for the notch, which is much more specific here. The line breaks, and that's your notch, and you'll perform the radio frequency at the suprascapular notch level. Thank you.